Sorry for my throat. I think I don't know what's the issue. Sorry. So, do you know what is today's topic? So, we are gonna continue our stomach. Not continue, we are going to start our stomach. What is stomach? Anyone? Do you know? You can
Part
say
of
dig.
gastrointestinal.
Yes, the part of. Continue.
Gastro, yeah, it comes after ingestion.
hmm
Okay. Uh,
So,
do you
this
want
is
to
your.
Stomach.
elaborate or is it okay?
Yes, it's so.
Stomach is the part of digestive tube that is located just below the diaphragm and the liver in the abdominal
hmm
cavity.
Okay. So, yes, a sac-like structure primarily responsible for digestion of protein localized in left hypochondriac and epigastric region. However, it can vary. For example, you have a patient and you want to do his CT scan. So CT scan is normally, it normally shows what? It either shows calcified structures or it shows gas. Only these two things you can see in the form of white, gray colors. But if you insert some contrast, for example, barium, then barium will be reflected by those X-rays of your CT scan and you will be able to see the stomach. Now, stomach can be of various shape. For example, it can be reverse L shape. Reverse L shape means somewhat like this. So your stomach will be, it will be like this. This is your reverse L-shaped. You till now, what had you studied? Stomach is J-shaped structure. Well, that was good enough for your NEET exam, but now you are in mid school. Second type which can be there, it can be J-shaped, which you have studied, where the stomach will resemble J-shaped structure. This is your stomach in J-shaped. Then you can have semi-lunar structure. Lunar means moon, semi means half, so it will have half moon-like structure. So yes, this looks like this. So it can also be a type of stomach. And then there can be steer horn shape. What is steer horn shape? You're driving a car, you have steering wheels, right? So it can be like a steer horn, which is just like very dilated. So what are the types of stomach which I just told you? This can be reverse L shape one. Second can be J shaped. Third can be semi lunar. And fourth, steer horn shaped. See, splanknology is very easy. You just have to listen everything. You might not need notes. In fact, when I studied the splanknology, I didn't even made the notes. So unfortunately, that won't be available to you because I myself didn't made it. So this was about the types of stomach. So if your teacher asks you about, the skeletotopy or volotopy, start with our sac-like structure, which is the stomach, a part of GI tract responsible for the primary digestion of the protein, can have various forms. So we cannot say exactly this will be located in the left hypochondriac epigastric. It can also dilate into the other levels. So not a single answer because they are seen. A face of a person is very different. Like in The 7.5 billion people, every people have individual face except for the twins. So why is that only limited for the face? No, everything in your body, each and every single thing has variations. But what you do, you only classify them as an average structure. For example, you will have nose. This will have like 4 centimeter length. It will have width of 3.5. So you have just classified everything, but no one will have same nose. No one will have same stomach, and no one will have anything similar to other person. In fact, not even the monozygotic twins. They also have environmental factors to affect it. You also have, equations to support it. Well, let's not go beyond the topic. Let's see the features of stomach. See, this is the difference between our anatomy jams and capsule courses. Here I will go into the periphery of the topic, but in them, like those are exam centric, so I don't think that's good to discuss everything. So, what are the features of the stomach? You have ends. How many ends? You have two ends. What are the two ends of the stomach? Cardiac end and pyloric end. Suppose I am making a stomach. I draw everything in front of you so that you also know and you get a hang of how to draw all the schemes. So this is your stomach. What end is this? This is your
Ready.
cardiac end. What end is this? This is your
Pyloric.
pyloric end, right? So we had two ends. What about the rest? First feature is end. Second is curvature. How many curvatures do you have? You have two curvature, greater curvature and lesser curvature. The curvature that you see here, this is your lesser curvature, and the curvature that you see here, this one
Greater.
and this one, these are your greater curvature. I will talk about how lesser momentum and everything is attached here. In fact, you will see that how everything is interposed with everything. I will merge every concepts. Then you have surfaces. How many surfaces do you have? Two surface, anterior surface and posterior surface. So the surface that you are watching right now, this is your anterior surface, and the surface which I'm going to draw right now, this is your posterior surface, right? So this was our third thing, anterior and posterior surface. What else do we have here? Now
Corpus.
see, no, I'm not talking about the parts. I'm just talking about
Okay.
the features. Now you have fourth thing, which is your openings, right? Or you can say rather than cardiac end, you had two ends. In that ends, you will have openings. How many openings do you have? At the
Two.
cardiac end, you will have cardiac opening. At the pyloric end, you will have pyloric opening.
Different.
So two opening. What openings? Cardiac
Cardiac.
opening or
Pyloric.
orifice. Orifice means what? Opening. Ostium means what? Opening. Apertura means what? Aperture or opening. And you have pyloric opening or orifice.
Yes.
Right. Do we have something else? No. This is the feature of stomach. Two ends, two opening, two curvature, and two surfaces. Right? Now, I will talk about everything, but let's talk about the openings or your orifices. Let's differentiate cardiac orifice and our pyloric orifice. Today I am well slept, so I will be taking your class very smoothly. Other days just 2 hours, 2.5, 1 hour, or maybe not sleep. So today's class will be very smooth. So You have cardiac opening and pyloric opening. Let's talk about the opening of your cardiac opening. Guys, tell me one thing. Suppose you are doing endoscopy. Have you heard about gastroesophageal junction,
Yes.
where the esophagus meets your stomach? Suppose you are doing an endoscopy. How will you know this is your gastroesophageal junction? Like
Presence of
in the
serosa and adventitia.
serosa and adventitia is present on the outside, but your camera is present inside. How can you know? Tell me.
A pyloric sphincter. Cardiac
How can you differentiate sphincters?
sphincter.
How? I just want to
By
listen whatever you are going to say. Just say whatever comes into your mind.
Diameter.
Diameters, no. You don't have a proper meter to actually measure it. So, something else. How
so
do you
if
know you reach the
esophagus,
gastroesophageal junction?
Mucus layer.
How mucus layer will help you determine it?
Epithelium
I'm taking
present
in your
on it.
brain right now. Yes?
By the epithelium present there.
Okay, so with a camera, can you see epithelium? First of all, tell me this.
Not possible. Camera.
Then how? If your camera is not, if your camera cannot see microscopic structure, then how can you say? Remember it. Now,
Because of sphinxter.
dear, you have sphincters. So yes, you can say this is your cardiac sphincter. So you might be able to say it. But gastroesophageal junction, see, cardiac sphincter does guard it. You can say, like but your cardiac sphincter is very dilated. Like it is not just present in a single spot. So this is not like a border. This is well dispersed. How can you say? Remember it. Let's remove it. See, sphincter is a good guess to say, but you can make a border. Suppose this is your esophagus and this is your stomach. Here you will have this border. Not the border. Your, what do we say? Uh, Sphincter. But you have to guess about this part. You can say this is your like sphincter, but you have to say specifically how. Like तुम्हें कैसे पता चलेगा? So remember it when you are doing an endoscopy, your gastroesophageal junction is 40 centimeters from incisor. Okay, is this okay?
Yes.
This is a good guess to use the sphincter, but to be honest, sphincter is not a single point. This is not like a single line. This is well spread. Like when you will go to the third year, you will have internal disease classes. And if you have good teacher, like I had, they will show you endoscopy. So let's talk about cardiac orifice and the pyloric orifice. So first of all, where is cardiac orifice located? Do you know
Head of the
position?
stomach.
2.5 centimeter to the left of junction of seventh costal cartilage and sternum. What do I mean with this? Suppose this is your sternum and this is your left side, this is your right side. We have seventh costal cartilage. It means we are talking about this cartilage. So 2.5 centimeter to the left of the junction of seventh costal cartilage and the sternum. It means If this is sternum and ribs junction, we have to take 2.5 centimeter. This is the place where your cardiac orifice is present. Okay, might be
Yes.
some detail, but now you know. What about the pyloric orifice? 1.5 centimeter right to median plane. Got it?
Yes.
Now you have vertebral level. At what vertebral level your cardiac orifice is located? This is located at the level of T11, while this is located at the level of lower border of L1. What was the lower border of L1? This was transpyloric plane, if you remember. This is why when I taught you the first lecture on the abdomen about the abdominal wall, I told you subcostal plane, transpyloric plane, supracrustal plane, and everything. Thus, remember it. Lower border of L1 known as transpyloric plane. Why transpyloric? Transmiss, transecting something. What transecting? Pylorus of the stomach or the pyloric opening. Now, what is the type of sphincter? The cardiac orifices, physiological. You will not have smooth muscle which will regulate it. I will tell you how. While this will have anatomical sphincter. See what happens is, suppose this is your stomach. You haven't eaten anything, but now you eat something. And now this part elevates above and this opening somewhat gets closed. Okay, so this had a sphincter. Sphincter is what? Some structure which regulates the flow from one part to another part. But this was physiological structure. The change in the anatomical structure due to a physiological reason which regulates the flow from one part to another part. This is your physiological sphincter. Guys, ज़्यादा नहीं हो रहा ना?
Yeah.
I'm trying to give the most because it will be better if you know lots of information. So, we talked about our openings. Let's talk about our curvature or the curves of stomach. How many curves does stomach have? It has lesser curvature and it has greater curvature, right? Let's see them one by one. If this is your stomach, what is attached at the lesser curvature? I need an answer from you. Do you remember peritoneum?
Yes.
Your lesser omentum is attached to it, right? So if I talk about the attachment, then what is attached here? At the lesser curvature, your lesser omentum is attached. What about your greater omentum? Sorry, greater curvature. You will have three things which will be attached here. What three things? Let's see. Sorry, this is a fat stomach. So at the superior part, what do you have here? Phrenic muscle or the diaphragm, right? Phrenic. At this part, you have spleen. And here you have transverse colon. So the part of peritoneum which attaches the fundus part of your stomach and the phrenic muscle. The part of peritoneum attaching the phrenic muscle and the part of your fundus. This is, I'm writing one, gastro means gastrum, phrenic means diaphragm. So a ligament which is attaching your stomach and the diaphragm. Second is your spleen. So what is attaching? What is attached here? You have your stomach or the gastro and spleen or the splenic ligament. Now you have your third. What is third here? Transverse colon. So how is your transverse colon attached here? Let's see. Suppose this is your stomach. This is your lesser curvature and this is your colon. What happens is your peritoneum will come, it will go down, right? Then there will be another peritoneum lining. And this part that you see here, this is your greater omentum, right? So this is third. And what is third? Greater omentum. So at the lesser curvature, you had lesser omentum, lesser curvature, lesser omentum, greater curvature, greater omentum. In the upper part, you had gastrophrenic ligament and gastrosplenic ligament. Isn't that clear है?
Yes.
Now let's talk about the portals. On which side it is present? It is present on the right border and it is present on the left border. Very simple. Anything else? Uh, yes, we will have some additional feature for our lesser curvature. And the lesser curvature additional feature will be angular or sorry, angular, not angular, just angular notch or incisura angularis. Incisura means what? Notch. And angularis means angle. So
Angle.
angular notch will be there. Besides, what else will be there? On the greater curvature, you won't have any additional, like, what do we say? Additional features. Is this clear to you?
Yes.
ज़्यादा तो नहीं हो रहा ना? How many students are here right now?
5.
Hmm?
5.
5. Let me see. And this guy is mute. 5. Okay. So we had angular notch here, and we did not had any specific thing because see, right part or this curvature is very smooth, right? Do you know what is angular notch? Do you know? Okay. Suppose this is your stomach. Stomach continues into what? It continues into your duodenum. So the notch which is formed between your stomach and the duodenum, this notch is known as angular notch.
Notch.
Now let's go to the parts of stomach. Parts of stomach. How many parts do you have? First will be your
4.
cardiac.
Cardiac.
Yes, cardiac part or cardia. Second is your fundus. Third is your body.
Body.
And fourth is your pylorus.
Pylorus.
Is this okay? Clear?
Yes.
Let's see. Let's draw each of the parts. Suppose this is your stomach. The part that you see here, this is known as fundus. You know why is fundus very important to study? For example, you suppose ate something, it got accumulated here. HCl came, it started to digest and it formed gas. So what will happen is this gas will ascend above and this will be stored in this part. So yes, fundus is primarily responsible for the storage of the gas. And if someone has, like acidity or something. Not acidity. If you have, someone had lots of gas, like he eats something, and now his stomach is like full of gas. So there is some problem. He will feel very pain, and the pain will be where? Do you know what? Where? This will be in the proximity of heart. Why? Because when the fundus expands, it reaches fifth intercostal space. And if you remember fifth intercostal space, this is the place where the apex of the heart was located. You remember? So if I'm saying your fundus reaches till this part, so if you feel any pain in your fundus, so won't like you will get confused, like you are having pain in your heart, right? If you have pain in your stomach and it is present close to your heart, you will feel like, oh, this is my day, right? So as your fundus expands, it can compress your diaphragm and it can go above and it can reach fifth intercostal space. It is located close to heart. Okay. One more thing. There is a condition known as gastroesophageal reflux disease or uh, heartburn or eclasia cardia. If the expansion of the fundus and this cardiac opening is not well regulated, and the notch that you see here, this is known as cardiac notch. If this notch is not so much prominent, then this opening will be not closed properly. So if something is not closed properly, what will happen? Gastric contents will go
Backflow.
above. And if it will go above, you will feel the sensation of burning. Where will you feel the sensation of burning? Do you know?
Apex.
In the heart region. Because when I taught you heart, this is why I taught the thorax in the beginning. When I taught you the thorax, here, heart, when I was teaching you about the sinuses, do you see this? This was your oblique sinus, and I had told you posterior to oblique sinus, this part that you see here. This is nothing. You see this arrow? This is nothing but your esophagus. And can you see the expansion of fundus here? So if acid will go above, it will feel that you are having pain posterior to your heart. Or if not so much localized, you will think you are having pain in your heart. Is this clear?
Yes.
You see how everything is now like getting together. So you will have pain in your heart region. One more thing. This is filled with gas, and I told you gas appears as black color in X-ray. So if I will show you the X-ray, this will be prominently visible. So we talked about the cardiac part. Remind me guys to show you the X-ray and describe you everything at the end of the class. So this was your cardiac part or the cardia. Now this is your fundus. Sorry, we talked about cardiac and the fundus. Cardiac was this entry point, and we had fundus. What is left now? Let's
Body.
remove them. This one done, this one done. We have our body. So this part that you see here, this entire part is known as body. Body contributes to the large part of your anterior and posterior surface. And histologically, this is the most important part because all of the modifications which you see will be present here. For example, I did not teach you this in the fundus part. You had oblique muscles, right? Oblique muscles will be absent in your fundus. This is a modification because you don't need that churning movement here. But in this body, oh, this is the most prominent part for everything. So this will have almost all the modification in its, you can say, at max. So body done. Next is your pylorus. Pylorus is what? This is your sphincter part. What sphincter will be here? Pyloric sphincter. Then you will have, let's see everything in a series. I will be writing here and I will show you everything here. In the pylorus, you have something known as pyloric antrum. Where is pyloric antrum? Just after the body, measures around 7.5 centimeter. This will be here. Then you have something known as pyloric canal. Again here, 2.5 centimeters. And then you will have the ending known as pylorus. Pylorus is what? This is the sphincter part. Here you will have that smooth muscle sphincter. Okay, smooth muscle sphincter. Got it?
Yes.
Now, what else? We talked about peritoneum. Here, lesser omentum. Here, greater omentum. Here, gastrophrenic ligament. Here, gastrocolic ligament. Everything is done. Let's talk about the visceral relations, or which we say synopy. Synopy, which I'm drawing, it might be different to the department because this is like what I'm drawing is from the Grays. They follow Sapin, so it might be slightly different. So please consider this. So first of all, let's draw our Gifford process and let's make our postal margins. And now let's take it to the stomach. Let's draw our liver. Let's take it to our stomach. It's colored, everything. It's better to appreciate everything when you have distinctive color for everything. See, guys, just give me time. Like, I will give you the content which you might not have seen anywhere on the internet. Everything will be very concise and so much detailed. So, this is your liver. Now, as I have already drawn the liver, you already know in this part of the stomach, you will have the relation with the stomach, liver. This entire part that you see, the rest of it will be covered by what? Diaphragm. So your fundus and the anterior surface of your stomach, most of the part will be covered by your diaphragm. Then the part that you see here, this will be in the close relation with the anterior abdominal wall. This is the reason why when there is, some surgery we have to perform, this is your abdominal wall and this is your stomach. So if you go from here, you will have liver and everything. But if you go from here, you just have abdominal wall and you can just pierce it. It might seem to like यार ये तो बहुत easy है फिर बता क्यों रहे हो? Yeah. Suppose this is your stomach and you have problem in this part. You have to suppose there was a tumor inside. You have to excise it. But if you go from here, you will have diaphragm, you will have liver. If you don't want to damage it, you can just go from here. Why? Because now you are not tampering with the liver and the diaphragm, just you are piercing your external oblique, internal oblique, transverse abdominis if you are going laterally. Okay? And if you are going from the medial part, you will have rectus abdominis. That is why I told you about the muscles at the beginning. Okay? Got this? Yes or no?
Yes.
Now, this part that you see here, just a second, this is known as gastric triangle. Let's change the color. Let's just remove these color and this will be easy for you to appreciate. This is your gastric triangle. What is gastric triangle? Formed by the margin of your liver, this costal margin, and inferiorly passing through the pylorus. What is so important about the gastric triangle? Have you studied about this in the department or somewhere? It would be easy for me. Otherwise, I will have to explain every basics.
No.
Have you studied it somewhere or not?
No.
Okay. See, this is a gastric triangle and it has three boundaries. First boundary is your inferior border of liver. I told you it is the only border of the liver which is prominent. Otherwise, you cannot distinguish between posterior inferior surface, right inferior surface, right anterior surface. This is the only prominent border. Revision from your liver class. Second, this was first, this is second. Second is what? This is your left costal margin. This is your third. This is your transverse colon present anteriorly, or you can say the duodenal part. Because in this part you have relation with the transverse colon. Why is this important? The clinical significance is this is used for gastrotomy. What is gastrotomy? Surgical, surgically operation onto the stomach. Don't think gastrectomy. Ectomy means removal. Tomy means you can say performing any function. Now this was your anterior relation. Let's talk about the posterior relation. Guys, is this okay or this is getting hectic? I'm continuously asking because I don't want to overload you. Is this okay?
Yes.
Good. How many students in the class?
Or
Okay. So posteriorly, in the fundus part, you will have the left crus of diaphragm. Which class? September 2nd, thoracic inlet and the diaphragm. No, September 2nd was embryology. So this is the first class of thorax, which I told you about, in which I told you about the diaphragm. So left crus will be here. Besides, what else will be here? Let me just draw everything. In the posterior part, you will have your colon. Okay. In this part, you will also have your pancreas. Pancreas is retroperitoneal and it is also present posterior to your stomach. So you will be able to see your pancreas here also. You know, the head, neck, uncinate process, apex, body. I will tell you about everything. This is your pancreas, it will be here. At the apex of the pancreas, what is present? Spleen is present. So you will see spleen here. This might be slight complicated than your sapien, but you have to study this. And then in this part, you have your kidney, and above kidney or superior to kidney is what? Suprarenal or adrenal gland. This is your kidney. This is your spleen. This is your pancreas. And if you remember celiac trunk, in the celiac trunk, I had told you there is an artery present superior border to your pancreas, going to the spleen, entering through the hilum using 4 to 6 hilar branches. So this is your celiac trunk, and this is your splenic artery. This is why I taught you blood vessels in the beginning. Was the mama? Okay. Inferior, you will have transverse colon here. Okay.
Okay.
And what is mesocolon? Mesocolon is the peritoneum through which your transverse colon hangs. Yes or no? So this will be present here in this part. Slight complicated, but this is what it is in the reality. You are in mid school. You are not in school that you will be studying something very basic. You have to know everything in an exact form. So this is your scene topic of the stomach. थोड़ा complicated हो गया क्या? Hello.
ठीक.
Good. Now let's talk about our interior of stomach. What are the things which are present inside the stomach? If this is your stomach, this will have internal folds. What are the name of the internal folds? Tell me. You have rugae or gastric folds. These are what? These are the distensions. Okay. In this, if I take a section from here, and if this is your, you know what? If this is your lining of stomach, this will have this pits. Pits का मतलब क्या होता है? गड्ढा. And then you will have your gastric glands here. Okay. And the part that you see here, in this part, this part is known as your gastric canal. See, if you drink water, your water will not be dancing everywhere and then it will go. No, this will just use this pathway and this will go to your duodenum. And the part which is used for rapid passage of the fluids, this is known as gastric canals. Okay.
Okay.
Now let's talk about the blood supply of the stomach. Let's draw it. If this is your stomach, let's take our stomach from this one. And a beautiful stomach. Let's draw it. Do you remember the blood supply of stomach? Yes or no?
Trunk.
Yes. You will have celiac trunk. Celiac trunk gives your abdominal aorta gives rise to celiac trunk. Celiac trunk gives rise to three branches. What are the three branches? Left gastric artery, celiac and splenic artery, which is going posterior to the stomach. If it is posterior, let's draw dotted line. Where is the splenic artery present? Let me just show you. Present here at the upper border of your pancreas. This is what posterior surface of the stomach. And I am saying your splenic artery is present posterior to the stomach. Here you will have your spleen. Here this will go give rise to many hilar branches and it will supply spleen. From the splenic artery again, short gastric artery will come and it will supply the fundus part of stomach. From the splenic artery again, left gastroepiploic artery will come and it will supply major part of your greater curvature. Okay. Celiac trunk gives rise to another branch known as common hepatic artery. Common hepatic artery gives rise to proper hepatic artery and gastroduodenal artery. From hepatic artery proper, right gastric artery comes and it anastomoses with left gastric artery. While from gastroduodenal artery, it divides into pancreatoduodenal and right gastroepiploic artery. And this is how your stomach is supplied with artery. Okay. If I show you the venous drainage, in the last class of the liver, I already told you what is portal vein, right? Present in the portal triad passing to the liver with the help of what? Gastro, uh, not gastro, hepatoduodenal ligament. If this is your liver and this is your duodenum, the terminal portion of your greater omentum is thick and it has three parts: bile duct, proper hepatic artery, and your portal vein. So if this is your portal vein, let's draw portal vein present posterior to your duodenum. This will have these two branches, and this branch will go posterior to where? To your spleen. See, spleen is a big topic. Like it will take me around one more class just for the spleen. So it's up to you if you want to study the spleen or not. Not needed for the anatomy. That is too much. Let me know. Here you will have another. See, let me just say it. This is your superior mesenteric vein. If you had superior mesenteric artery, you will also have superior mesenteric vein. Superior mesenteric artery was carrying blood supply from what? Sigmoid colon, ileum and cecum, appendix, and the two-third part of the transverse colon. It was artery. So similarly, if you have superior mesenteric vein, it will also carry it. Now, superior mesenteric vein divides into this splenic vein and this portal vein. Okay, splenic vein gives rise to this artery, or which goes to inferior mesenteric vein, or you can say inferior mesenteric vein also comes here to drain your spleen. Okay, inferior mesenteric vein. From this portal vein, left gastric vein will come and right gastric vein will come. From your splenic vein, short gastric vein will come and left gastroepiploic vein will come. From the superior mesenteric vein, your right gastroepiploic vein will come and it will anastomose. And this is the arterial and venous supply of your stomach. Got it? have you started lymphatic drainage or not in the department?
In lectures.
Started Bhaiya. Yes.
So you want me to teach the lymphatic drainage right now, or you want a special class and then lymphatic drainage of all the structures?
We will do the lymphatic drainage of all structures altogether.
Okay, that would be good. Okay, so this was your stomach. How was the session?
Good.
Was it hectic? Did you understand everything?
Not hectic.
Guys, do you want this template, this annotations?
Yes, Bhaiya. हाँ.
Okay, I will just export it. Admin jumps semester November, and I am uploading here. Please, whatever I have said, just interconnect everything. Everything will make sense. And from this point, you will be living an ad. You won't be just reading it. You will know how everything is functioning, how everything is connected. See, Anatomy Champ semester November. In this, I have uploaded this annotated part. Okay. Do you have any question from today's class? Hello.
No, Bhaiya, no doubts. No.
Good. And rest of you guys, Utsav
No.
and Kaushik. If you come up with any doubt, just text me on the WhatsApp. I will answer you. Have a great day. Good night. And yeah,
Thank
sorry,
you.
sorry. Wait. You're welcome. Wait. I had to show you the X-ray image, right? I had told you guys to remind me, but you guys forgot it. Very bad. X-ray contrast in X-ray of stomach. You will not be like studying everything from, you won't be studying radiology right now, but you would know enough anatomy that you would be able to see all the structures. Let's take only the X-ray, X-ray and not the CT, so that you can see the fundus. Okay, this one's good. Guys, can you see this black dot here? Here,
Yes.
let's copy this and show you. I had showed you, I had told you gas appears as black. This is why your lungs is black in color on the X-rays, because gases appears black. So here, this is your fundus of the stomach. Got it? Similarly, this is your lungs here, all those vertebrae. Got it? And guys, please, whoever watching this recording, please come to the classes. It's really amazing to have all the classes. Otherwise, just think you have internet. You can study whatever you want. You really don't do it because you don't have pressure. So if you come to the live classes, you will have that for sure. And that would be good for me also if I'm taking time for it. That would be good. Okay, so okay, Deepak, and okay, Kaushik. Let's see you guys in the next class. Have a great day. Good night.
Bye, Bhaiya.
Bye.